Welcome to our channel. In this video, we will see sexually transmitted diseases during pregnancy. Before we begin, please like this video, give it a thumbs up and share it with your friends. For more information, please click the links in the description. STDs are silent conditions that endanger the wearer's life, and even more so that of a fetus. The STD plus pregnancy scenario is not recommended at all. Prevention is the key. Sexually transmitted diseases, STDs, can infect a sexually active woman. If she is positive and pregnant, it is obvious that she will not only endanger herself but also the normal development of pregnancy and the life of the future baby. In short, the STD and pregnancy scenario is therefore the least suitable for giving life. A pregnant woman can contract STDs if she has sex with an infected partner. In addition, a woman who is already infected with an STD can become pregnant, a scenario in which the disease affects the developing baby. Since many STDs are silent, transmission can also occur well before pregnancy. For this reason, it is essential that frankness prevails in the relationship between the doctor and the pregnant woman, so that the specialist can take the necessary measures from the start of pregnancy. Once a pregnant woman starts medical monitoring, screening for sexually transmitted diseases should be part of the routine. These tests should include HIV, human immunodeficiency virus. Especially if the woman does not have a regular partner or if she or her partner has engaged in high-risk sexual behavior. STDs are infections of bacterial or viral origin that spread through the vagina, oral or anal route. They can remain dormant in the body for several years, but once a woman is pregnant, action must be taken immediately. STD testing is done during the first trimester of pregnancy and is repeated near the time of delivery. If STDs are detected early, they can be treated. Early detection is essential to protect the health of the pregnant woman and the future baby. Treatment of sexually transmitted diseases and pregnancy. STDs of bacterial origin such as chlamydia, gonorrhea, syphilis, trichomoniasis, and bacterial vaginosis are treated and cured with antibiotics, which are generally safe during pregnancy. Your doctor will tell you which are the safest. Regarding sexually transmitted diseases caused by viruses such as genital herpes, hepatitis B or HIV are not curable. However, pregnant women may receive antiviral medication or take other preventive measures to reduce the risk of transmission to the baby. STDs and pregnancy are a combination of complicated consequences. If you are planning to get pregnant, you should get tested with your partner so that you can possibly treat yourself and protect the unborn baby. If you already have an STD, the sooner you start treatment, the better the results. Treatment for an STD must be taken by both partners. On the other hand, there should be no sexual intercourse until they have finished their treatment and have no more symptoms. Otherwise, they will continue to transmit the infection to each other. Sexually transmitted diseases cause serious complications. Indeed, the mother can infect the baby during pregnancy or during vaginal birth, which exposes the baby to many risks. An STD can cause premature birth before 37 weeks of pregnancy, premature rupture of the membranes, rupture of the amniotic sac before the start of labor, low birth weight, baby weighs less than 2 kilos 600 grams, birth defects that change the shape or function of one or more parts of the body, ectopic pregnancy, miscarriage, the baby dies in the womb before the 20th week, stillborn baby, baby dies in the womb after 20 weeks. If the mother transmits an STD to the baby can be affected by eye infection, pneumonia, brain damage, lack of coordination in body movements, blindness, deafness, acute hepatitis, meningitis, chronic liver disease, which can leave scars on the liver, cirrhosis. Is it possible to breastfeed with a sexually transmitted disease? Some STDs affect breastfeeding and others do not. Talk to your doctor or breastfeeding consultant about the risks of transmission to your baby. Here are the basic preventive measures for 4 common infections. HIV, you should not breastfeed your baby. Rather, use milk formulas. Chlamydia, gonorrhea, or HPV, you can breastfeed your baby. Trichomoniasis, you can take the antibiotic 12 to 24 hours before breastfeeding your baby. Syphilis or herpes, you can breastfeed as long as your baby or your breast pump does not touch any sores. Remember that, before becoming pregnant, if you need to be screened for STDs, it is imperative that you do it again during your pregnancy. If you are pregnant, the only way to avoid sexually transmitted diseases is to not have vaginal, anal, or oral sex. Unless you have a healthy partner and you are both monogamous. The only way to reduce the risk of getting an STD during pregnancy is to use latex condoms correctly. Especially if your partner also has sex with other people. STDs in pregnancy are ultimately a risky scenario for a new life to begin its journey into this world. Finally, STD prevention is possible, and it is in your hands. Thank you for watching. You can watch more videos by clicking the links in the description. If you like this video, give it a thumbs up and share it with your friends.